everyone, this is Health Bites from our specialists. I'm Genevieve and with me is Ms. Gormit, a Nursing Deputy Director here at Sengkang General Hospital.
Hi, I'm Gormit.
This year we celebrate 140 years of nursing here in Singapore. Wow! So what better way to celebrate this special milestone than to uncover the remarkable journey of nursing as a profession? So the first question I have, Ms. Gormit, is many people might think that nurses do kind of the same job, but can you tell us more about the different roles that nurses play today?
So, of course, as nurses, after our training and when we graduate, we do start working in the wards, whether you're a enrolled nurse or a registered nurse. Nurses subsequently progress on to different career paths, whether you want to do management, education, research, informatics, or innovation. This maybe started from the early Christian church, maybe medieval Europe, when they used to have Sisters of Mercy, a Sister of Charity. Florence Nightingale, who is the founder of modern nursing, she actually kind of reserved this title for nurses who were taking care of the sick or caregivers. If you would have noticed, I'm sure, we also have male nurses who are, nurse clinicians or could be a senior nurse manager. It's basically now a title, term just reserved for a senior nurse. And if you know the nurse well enough, especially if it's a junior nurse, you could just call them by name, yeah.
Healthcare has evolved so much over the years. So what is one of the biggest changes that you've seen in nursing since you started?
Many years ago, I think you wouldn't hear about technology or telehealth. That's very much an in thing, and now we have a nurse innovator, nurse researcher. Like during my time, I did do research, but it was not like a role per se, it was just something that you did after work. Now you also have nurse informatics, you also have community nurse, and I think that's a really important segment of nursing, especially when we want patients who are actually well enough to stay at home. They don't really need acute monitoring in that sense, and our community nurses can actually follow up with them at home. Yeah, that's really coming up in a big way too now. Yeah, so it's not a secret, right? There's always, in that sense, shortage of nursing manpower. It's a worldwide thing, and we do rely on foreign manpower. So we want them to assimilate into our culture. So we have a transcultural program where we actually share with them about the different nuances of each culture. For a Muslim, you must make sure that the food is halal. It's because it's part of your religious principle. If it's a Sikh, like I'm a Sikh, and the patient is to go for an operation, if you need to shave or cut the hair or shave the beard, you need to let them know, and they will make the decision whether to proceed or not. Yeah.
What made nursing your calling for your profession?
Okay, yeah, so I didn't really envisage that I was going to be a nurse. I love to read and write, so I thought maybe I'll be a journalist. But then there was a demand for nurse, and it was because of my circumstance. My dad passed away and was 9 years old, and my mom was bringing us up by sewing clothes. She was a seamstress. So I thought this was kind of a good deal in that sense, because I would be paid a stipend while I was studying. Along the way, I did do my A-levels by night class, and I was fortunate enough to be awarded the WHO scholarship. So I was also able to do my degree, and of course I progressed after that. So in that sense, I've been fortunate. Nursing has provided a lot of opportunities for me. It is exciting. No day is, in that sense, same. And you can of course go into various career paths if you want to. So I'm glad actually I chose nursing. In that sense, I have no regrets. Yeah.
So how long have you been a nurse?
Well, it's I would say it's more than 40 years if you include my training period as well. Yeah.
Wow, 40 years. Very congratulations to you.
Thank you.
So to all the nurses who are at the forefront of our patient care every day, a very happy Nurses Day to you. We'll see you in the next episode of Health Bites from our specialists. Bye.
Bye.